What is miliary TB, the disseminated disease? Imagine tiny seeds scattered throughout your body, each about the size of a millet grain, spreading through your blood and affecting many organs at once. That's what happens in miliary tuberculosis, a serious form of tuberculosis that can be life-threatening if not caught early. It starts when the bacteria responsible for tuberculosis, called Mycobacterium tuberculosis, enter the bloodstream from an initial infection, often in the lungs. Instead of staying localized, these bacteria travel widely, infecting multiple organs such as the liver, bone marrow, lymph nodes, brain coverings, and sometimes even the heart lining. Because these bacteria spread so extensively, they cause small lesions or nodules that look like tiny millet seeds on imaging scans. These lesions are usually between 1 and 5 millimeters in size. And like typical tuberculosis, which often affects just the lungs, miliary TB involves many parts of the body simultaneously, making it a systemic disease. The symptoms can be quite vague and nonspecific, which makes diagnosis tricky. People often experience prolonged fever that worsens in the evenings, unexplained weight loss, fatigue, night sweats, and a persistent dry cough. Sometimes, blood may be coughed up if the lungs are involved, and if the bone marrow or brain coverings are affected, additional symptoms like anemia or neurological issues could appear. There are two main types of miliary tuberculosis. The first is acute miliary TB, which tends to affect younger people under 40 and presents with more intense symptoms like high fevers, night sweats lasting for 1 or 2 weeks, cough with phlegm or blood, and shortness of breath. The second is cryptic miliary TB, which develops more slowly and with less obvious signs, often requiring doctors to be very alert and considerate in their diagnosis. Miliary TB is more common in young children, especially those under 4 years old, older adults, and individuals with weakened immune systems, such as people living with HIV. If not diagnosed and treated promptly, it can be fatal because of the extensive damage it causes across multiple organs. Diagnosis involves imaging tests like chest X-rays or CORT scans that reveal the characteristic tiny nodules scattered throughout the lungs and other affected organs. Microbiological tests, including sputum analysis or tissue biopsies, help confirm the presence of Mycobacterium tuberculosis. Treatment involves a long course of standard antituberculosis medications, usually lasting at least 6 months, and must be supervised by healthcare professionals. Early diagnosis and proper treatment are essential to prevent severe complications or death. In summary, miliary tuberculosis is a disseminated form of TB where bacteria spread through the bloodstream, creating widespread tiny lesions and systemic symptoms. It's a serious condition that requires immediate medical attention and comprehensive care. If you suspect you or someone else might have symptoms of TB, especially if they involve multiple organs, it's crucial to consult a healthcare provider for proper testing and treatment.